Dopamine is a classical neurotransmitter predominantly made in the brain and lets the cells talk to one another. Dopamine, however, also circulates in the bloodstream. In fact, dopamine is called the happy hormone because when you feel comfortable after eating, when you feel good after exercise, it's all driven by dopamine. The problem in Parkinson's disease is dopamine is selectively depleted in the substantia nigra. So the approaches to treatment had been to replace with dopamine, but when you give dopamine, it is metabolized, therefore you have to give it as L-dopa, which is the levorotatory form of dopa. L-dopa acts both in the periphery and in the brain, but it doesn't get adequate concentration in the brain without side effects like muscle tremors, fatigue, nausea, and vomiting. So what they do is they combine L-dopa with a drug called carbidopa. Carbidopa blocks the effect of dopamine in the peripheral parts, permits L-dopa to get into the brain in higher concentrations, and therefore replace the deficiency. So that was the first major breakthrough. Following that, they have found other groups of drugs which mimic the effect of dopamine by binding to what are called dopamine receptors in the brain. Thirdly, there are drugs which inhibit or prevent the breakdown of dopamine in the brain, thereby preserving it, and that is called siligilene, or sometimes dopamine is broken outside in the brain peripherally, and that's a drug called entacapone, which is what is called carboxymethyltransferase inhibitor. So you inhibit the breakdown in the brain or in the periphery, permitting higher levels to retain in the brain, or you replace L-dopamine with carbidopa, and or use drugs which promote or mimic dopamine by acting on the receptors, and that's the pramipexole. There are powerhouses in the neurons called mitochondria. The mitochondria generate energy. For reasons unknown, the mitochondria in patients with Parkinson's disease fail as a powerhouse. Therefore, the metabolism of the nerve cell is abnormal, and there is accumulation of a substance called alpha-synucleic acid, and this results in a disruption of the cells or neurons in the substantia nigra, leading to dopamine deficiency. Movements of the body are of two types. One is voluntary, where we purposefully move the arm or the leg. And the second is called involuntary or automatic associated movements, which is like swinging the arms when you walk, or, for example, some people move their eyes when they want to see an object in coordination with the neck. Voluntary movements are controlled by part of the brain which is outside the substantia nigra, and that's called the cortical cells, which are usually affected in strokes. Whereas extrapyramidal or automatic associated movements are regulated by substantia nigra and corpus striatum, and that is where the major defect is in Parkinson's. That is why patients with Parkinson's, when they walk, they don't swing their arms, and when they lean forwards and they start walking, they can't go left, right slowly. They start chasing their footsteps. They start running rather than walking because the regulation is defective, or the automatic associated movement is not regulated. Why are the heart and breathing movements not affected in Parkinson's until late in the disease? The reason is the regulation of the heartbeat as well as the breathing is controlled by what's called the cardiac center and the breathing center, which is located in the medulla oblongata or the brainstem, which is far away from the substantia nigra anatomically. Therefore, in Parkinson's disease, they are not affected as a routine. Later, as the disease progresses, the associated regulation becomes abnormal, and therefore you do get some changes in the heart rate and breathing pattern.